Well, hello. I'm Hernan Montenegro, and I'm a health systems advisor working at the World Health Organization in Geneva, Switzerland. I'm visiting here, Australia, attending an international conference on primary health care in Brisbane. Right now in Canberra, talking to government officials working on primary health care. And tomorrow I'm going to Sydney to talk also with some research groups and some other interested parties all around the subject of primary health care. And one of the things I'd like to say is that from the perspective of our organization, we strongly believe on the key role of primary health care within the larger health system of any country. It's fundamental. We know that health systems that are based on a very strong primary health care are more effective in terms of health outcomes at the population level. They are more equitable, they're more efficient, and they usually satisfy more their users. So they play a key role in improving the performance of the system and responding to people's health needs, demands, and expectations. In this, independently of the context, it works very well in developed countries such as Australia, but also you can see it working well in less developed with less resources countries such as Thailand, or even more with less resources such as Cuba. It's always, we find the same, that these systems strongly based on primary care, they perform much better. The other aspect I like to refer to is that when you look at the international context, all countries basically around the world are trying to reform their health systems so they become more efficient and more accessible and equitable. So a lot of these reforms are about strengthening primary health care, and that means like having a population base to take care of the entire community at the same time of the individual, having people assigned to specific practice or being registered to it, having a multidisciplinary team that is able to respond to them. And we see a lot of like a push towards more family and community orientation of this system. So the role of family practitioners or general practitioners is very important because basically they provide care with very important attributes such as, general services. They're not just specific to one condition, one health problem. They are family-oriented, they're community-oriented, they coordinate care, they're person-centered, etc. So these attributes are very important. More and more we see also strengthening the coordination of care across the different sectors, secondary, tertiary, as well as with other sectors to try to address other determinants of health. Push towards better training, more focus on quality of care, responding to the needs of the population and ensuring social participation in health. Now, in order to have this improved reforms, we need to inform them with research. And so that's why we're interested in the question how you incorporate primary care research into policy making so your policies are better informed, are of better quality. So I'm also talking and discussing this issue here in Australia, and WHO strongly supports, evidence-informed policy making. So research is very important for that, and how you go about translating that important research into policy making. And one of the aspects we're discussing here is how to support an international network on implementation research to improve primary care. And we're working with our colleagues here to see how we can, from the WHO, collaborate in bringing more international experience so Australia can benefit from that knowledge, and likewise the other way around, how Australia can contribute to better policy making abroad.